Welcome back to the Healing Nurse channel. It's your girl, Nurse Coach Shell, back with another video. This is the final video in our Understanding Diabetes series. And this week we will be discussing type 3 diabetes. Type 3 diabetes is a controversial, non-official term used by some researchers and health professionals to describe Alzheimer's disease as a form of diabetes affecting the brain. While it's not an official diagnosis, so you won't find it in any medical textbooks or on any lab reports, it is a hypothesis, though, that Alzheimer's is linked to insulin resistance in the brain, making it a brain-specific form of diabetes caused by impaired insulin signaling in the central nervous system. So studies have shown people with type 2 diabetes are at a higher risk for developing Alzheimer's disease, and brain scans of Alzheimer's patients often show patterns similar to what you would see in someone with insulin resistance. They have found insulin and IGF, or insulin-like growth factor, deficiencies of the brain in Alzheimer's patients, and this is why they think that there's a link between the two. So insulin is more than just needed to Insulin is needed for more than just treating blood sugar. It also helps your brain cells absorb glucose for energy. So when your brain cells become insulin resistant, they struggle to get that fuel, which leads to dysfunction and eventually neurodegeneration of the neurons. So this is similar to how muscle and fat cells behave in type 2 diabetes, but it happens in the brain instead, and it affects memory, learning, and cognition. So contrary to older beliefs, insulin does act in the brain, even though the brain doesn't rely on insulin to absorb glucose the way muscles and fat do. In the brain, insulin is critical for neuroplasticity, which is how well the brain adapts and learns, memory and learning, especially in the hippocampus, neurotransmitter regulation like acetylcholine, which is key for your memory, inflammation control, brain cell survival, and synaptic health, which is connections between the neurons. The brain has insulin receptors concentrated in areas involved in cognition, emotion, and metabolism, like the hippocampus, hypothalamus, and prefrontal cortex. In Alzheimer's and possibly in type 3 diabetes, insulin signaling becomes impaired. Either there's less insulin in the brain or the brain stops responding to it altogether. Neurons then become insulin resistant, like fat or muscle cells do in type 2, as I just mentioned, but also glucose metabolism drops, starving the brain cells of energy. Then amyloid beta plaques begin to accumulate as a result of this insulin resistance, which is linked to poor clearance of amyloid beta, which is one of the trademark symptoms or effects of Alzheimer's. You also have an increase in tau tangles, which is another Alzheimer's hallmark, worsened by disrupted insulin IGF signaling, and inflammation rises, further damaging the neurons. Now, insulin growth factor 1 and insulin growth factor 2 are hormones that work really close with insulin, but have unique roles in the brain development and repair. So IGF functions in the brain by promoting neuron growth and survival. It enhances memory and learning, and it supports myelination of or nerve insulation. It helps with synaptic plasticity. IGF deficiency in the brain is linked to decreased cognitive function, accelerated neurodegeneration, increased oxidative stress and inflammation, poor clearance of amyloid beta, as I just mentioned, and also research shows that lower levels of IGF-1 in patients with Alzheimer's, along with reduced IGF signaling pathways in key brain regions. So the Alzheimer's brain shows decreased insulin receptor expression and reduced insulin signaling, as well as less IGF activity. And this makes it harder for the neurons to metabolize glucose, their primary energy source. It makes it harder for them to communicate with each other or regenerate or repair damage, and the result is progressive cognitive decline. You may be asking if you can prevent or slow this from occurring. While there's no cure for Alzheimer's or type 3 diabetes, there is promising evidence that lifestyle change may reduce the risk through balanced diet, low in refined carbs, as discussed before, high in fiber, high in omega-3s and antioxidants. Exercise is always important. It improves insulin sensitivity and brain function. Sleep is essential for brain detox and blood sugar control, especially if you have type 2, is important, as well as cognitive engagement by learning frequently and mental activity and exercises through like puzzles, doing Sudoku, word finds, word challenges, trivia, that sort of thing to keep the brain active. Now, the major risk factors for the development of type 3 diabetes is, like I mentioned, if you're someone who does have type 2 diabetes, being overweight, having chronic inflammation, which can occur when you're under increased stress due to the constant release of cortisol into the system, having a poor diet, having a sedentary lifestyle, as well as genetics. Now, symptoms of type 3 diabetes, because it overlaps with Alzheimer's, it includes memory loss, confusion, mood changes, difficulty with problem solving, trouble speaking or understanding language. And so it is important to understand that type 3 diabetes is a type of insulin resistance in the brain, and while it's not officially recognized by major medical organizations, however, research is still being conducted to connect the two between the metabolic health and brain health is becoming really big. So there are some supporting research that I found. Yale School of Medicine, they found that brain insulin resistance could occur independently of body-wide insulin resistance, making it a distinct metabolic issue. While Brown University, there's a Dr. Suzanne De La Monte. She coined the term type 3 diabetes to describe Alzheimer's as a brain-specific form of diabetes due to insulin IGF signaling defects, as well as the Journal of Alzheimer's Disease. In their studies show disrupted insulin IGF pathways that correlate strongly with brain tissue damage in Alzheimer's patients. So while there's no cure, there are some strategies being researched to restore insulin IGF function in the brain. One way is intranasal insulin therapy, which delivers insulin directly to the brain. Lifestyle interventions that I mentioned before, a low glycemic diet, exercise and sleep, omega-3s and polyphenols, anti-inflammatory and neuroprotectives. And then there's also the use of medication like metformin and GLP-1s, like the Ozempics that I had spoken about in the other episodes, just talking about type 1 and type 2 diabetes, which have wonderful help with control of the blood sugar and insulin resistance, but it's also being tested for cognitive benefits. So type 3 diabetes, although it's not an official diagnosis, it is something that they are closely paying attention to. And if you are someone with type 2 diabetes, it is going to be very important for you to take be very cautious in how you manage your diabetes, making sure that you keep your numbers in normal limits. Keeping your blood sugars low is going to be essential because, as I mentioned before, not only does it impact your blood sugar, but it impacts everything within your body, it could lead, excuse me, I'm kind of falling over my words, but uncontrolled blood sugars could lead to other complications like neuropathy, which is nerve damage, causing tingling, numbness, decreased sensation in the hands and feet. It can lead to unhealed wounds as a result of nerve damage. It could lead to vision loss as a result of nerve damage. So as you can see, nerve damage is something that is a critical risk to take when your blood sugars are out of whack for a length of time. And like I mentioned before, type 2 diabetes is something that could potentially be reversed. So exercise, a well-balanced diet, getting proper sleep, taking your medication as needed, getting that A1C down below 5.7 are all things that should be a goal that you're striving for. And I did not mention this at the beginning of the video, but if you have not subscribed to the channel yet, I would appreciate if you would subscribe, comment, share. I'm trying to build this channel, and I understand that, you know, it takes a village to build these things up. And so I would love for you to support and give me ideas of things that you would like me to go over. And as I mentioned before, I am a very new channel, very novice to the technology involved with doing videos. I see videos that are amazing with things popping in, and I hope that eventually I will be able to get that advanced as well. And I pray that, you know, people will, that you all will subscribe and stick it out with me until I can figure everything out. And as I mentioned also before, you can book a free 30-minute discovery call with me if you are interested in discussing more about diabetes control or any other chronic disease that you may be managing in your life. If you have a polypharmacy, which is a long list of medications that you're on, we can work together to see what can be done, potentially along with, in conjunction with your healthcare provider, because I am not a medical doctor. I cannot diagnose or prescribe medications, but I am a registered nurse who can offer education on medications and chronic disease. I also wanted to mention that you can get your free Understanding Diabetes ebook linked below, as well as a couple of other free downloads that you are more than welcome to take advantage of, that are linked below in the description. I appreciate your time. I thank you for being here with me. Now, this completes our Understanding Diabetes series, and going forward, we will probably walk into more of things impacting our everyday lives that could eventually lead to chronic disease if you allow it to, but this will be more so leaned toward limiting beliefs and getting to becoming your best self possible, stepping into your greatness and finding your voice, stepping out of your comfort zone if you feel stuck, and just finding and leading a charge for your best life possible. Okay, I'm going to end this here. It's getting a little long. Thank you so much for your time, and I hope to see you subscribed, and I hope to see your comments below, and I hope to see you again in the next video. Peace.